Some nurses at the Maypen Hospital are not happy. For years, many have been working without being appointed. What does this mean? Loss of major benefits. The nurses we spoke to from the Maypen Hospital did not want to be identified.
When I received the employment, my job letter stated that after 6 months probation period, pending the outcome of a performance evaluation, then we would have been appointed. If you're not been appointed, then you won't get the increments and you won't accumulate a pension benefit.
This nurse has been working at the Maypen Hospital for over 6 years. But this situation is not unique to Maypen. Many of our nurses across the health sector are being denied some basic benefits. Acting Senior Public Health Nurse at the St. Mary Health Department and the chairperson for the Nurses Association of Jamaica NAJ Socio-Economic and Welfare Committee, Dawn Marie Richards, explains.
It is affecting nurses across the island. At Notre Bay Hospital, I can give you an example. They have a cater for 8 specialist nurses. Now these are nurses who would have, after you have completed your general program and you have become a registered nurse, you go and you do something else, maybe midwifery, operating theatre, pediatrics, psychiatry, whatever it is, the specialty that you're into. And you go and you do these specialties and you come back. And Notre Bay only has 8 posts for those individuals. The current situation is they have 11 midwives, they have pediatric nurses, they have operating theatre nurses, they have critical care nurses, they have A&E nurses, and all of these positions are specialist positions. How many of them can we appoint?
When we asked the Ministry of Health to give us an idea of the number of nurses at the Maypen Hospital that were not appointed, they refused, stating, quote, "Out of respect for the persons and the complexities involved, we are not prepared to divulge this number." However, Recording Secretary at the NAJ, Nurse Patsy Edwards Henry, did.
Maypen has 28 posts for registered nurses. They have 88 nurses on staff.
Nurse Edwards Henry also highlighted the situation at the Kingston Public Hospital.
Kingston Public Hospital, which is the largest hospital in the English-speaking Caribbean, which accepts referrals from all over the Caribbean, they have a cadre for 148 entry-level nurses. So that's nurses level 1. To date, they have 320 nurses in that level employed to the hospital.
The ministry also refused to comment on the overall concern of non-appointment, stating, quote, "Great care and due consideration must be given to dealing with local level personnel matters in the public domain. But this seems to be more than just a mere local level personnel matter."
This has been a problem going back, I think, to the 1970s in the public sector, whereby there have been bars placed on the appointment of individuals and the creation of new positions.
Helene Davis White, president of the Jamaica Association of Local Government Officers, JALGO, gives a clear picture of what's happening in the general public sector.
There was a change in how the health services was organized somewhere in the late 1990s, and we have had situations where it was expected that the human resource needs would have been addressed when they were creating regional health authorities.
The Civil Service Establishment Act of 1976, that speaks in part to the establishment or abolition of offices in the public sector, where nurses are concerned, was last amended in 1998.
We have upgraded a number of our services. The Maypen Hospital has been upgraded from a type C to a type B, where that means that the number of beds and the services offered have been increased.
We have situations at one particular hospital where we represent ward assistants, where we have possibly about 50 ward assistants and only 15 posts. So it means all the others, and many of them have been working since the 1980s and the 1990s, and they have not been appointed.
The ministry also noted that Jamaica's health service and the entire civil service is presently undergoing a process of reform through modernization and transformation. Therefore, the nurses' concerns will be addressed. But this is little comfort for some.
One of the things that happens when you are not appointed is that you remain always at the minimum of your pay grade. And so the increments that would apply, whether performance-based or just increments are applied yearly, cannot be paid because you are not appointed.
As we work over the years, we all look forward to a pension. Now, the first thing, those persons who are not appointed are not entitled to a pension.
God forbid and you never get appointed and you reach retirement age, because not everybody go into nursing at 17. Some people go into nursing at 40. So are you telling me that it is not important for this person to be appointed that by they are 60 and they're retiring, they're not retiring at the bottom of the rung?
The lack of appointment means that you have workers who really have no security of tenure.
The nurses have received some assurances, though. The reclassification, which was completed in 2009 and signed off by Cabinet in 2012, should have come into effect on April 1 this year. The reclassification should see increases in wages and some benefits. However, the nurses want it to be known that the matter of non-appointment is still a serious issue.
It is so important that it is an agenda item at my committee meeting. It is an agenda item at the executive meeting that we keep every Wednesday, every first Wednesday. When we go to our annual general meeting, it is on the agenda. Wouldn't you say that it is important to us?
It's selfish because at the end of the day, everybody wants to put on a pot. Yeah, and as I said before, when we retire, we should be able to retire in comfort.
So, in this already difficult economic climate in Jamaica, with the wage freezes and the constant devaluation of the dollar, the MAPEN nurses are hoping an ear will be given to their desperate pleas.
We have been given the assurance from our Ministry of Health that the rationalization of posts, it is being looked into, but we are asking and we are seeking and we are hoping that persons, the powers that be, will understand the magnitude of what happens to a nurse when she's not appointed.